started and not delay anymore. First of all, good morning. Happy Wednesday. Glad everyone is able to join us today for office hours. As always, the chat box is open for questions. We do have several pre-submitted questions, so we will tackle those first as we always do. And then we have a little information we want to share with you as well. So pretty much same routine as we always have, and we'll start it out by going to Commissioner Turner first. Good morning, Commissioner. Commissioner, you're on mute. Or Commissioner might not have audio at all. Hey, Commissioner, if you want to run in my office and okay, he's going to try to call in. All right, folks, we are just getting started, but if not, he is just across on the other side of this wall, so hopefully we can get this sorted out. Hope everyone's having a good week. We'll talk just some of the things we'll talk about. We'll once again talk about some of the vaccination efforts. We got some questions about licensure. We got some questions about IDD integration. And we are, of course, open to talk about anything else you would like to talk about as well. We will have a little information in just a second about reportable event management also. So we will continue to have those discussions as well. Commissioner, you got some audio now?
Yeah, I should. Can you hear me? Awesome.
Yeah, I can.
There we go. Perfect. Hey, good morning, everybody. Again, thanks for joining us. Certainly appreciate your time. And I know this is important. We've gotten a lot of good feedback from different providers and different groups that we work with on the value of office hours. So we certainly appreciate that. Looking forward to the questions today. I know there's a lot going on. Kara had shared with me some of the questions that have come in. I know they're of significance and very serious questions. We want to make sure we get you answers. But again, I just want to say thank you to you guys for your partnership. It's hard to believe that we're actually coming up on almost a year of this pandemic. But I think we've done a pretty good job of making sure that we're still supporting people. And a huge part of that is you and your partnership. And the folks that work with you. So thank you for everything that you're doing. Looking forward to the questions. And with that, I'll pivot back to Kara. Thanks, everyone.
Sorry, guys, I was on mute. All right, so the first question we've got is from Jordan, for Jordan. And the question is what is the timetable and process for amending the 1915C waiver? So, Jordan, if you'd like to take that on, I will turn it over to you.
Sure thing. Good morning. Thanks, Kara. So the 1915C amendment really needs to get submitted to CMS no later than April 1st. CMS, as many of you probably know, will require 90 days to review the amendment. And despite the fact that the amendment's not going to be overly substantive in nature, we certainly want to give them at least that amount of time and preferably earlier. So as I discussed a little bit last week, we plan to have the first draft of the 1915C amendment ready and post that publicly sometime within the next couple of weeks. Obviously, like all of you, we've got multiple competing priorities, and it's just we're getting to it as quickly as we possibly can. We will post that as soon as it's ready, give the period for public comment, and then also obviously hold the stakeholder feedback sessions, WebExes, consistent with the way we've done things throughout the process. So no later than April 1st, it needs to get off to CMS, and between now and April 1st, we need to get it posted, get feedback back from our community and our stakeholders, make any adjustments, and then get it ready to fire off to the Fed.
All right, thank you very much, Jordan, for that explanation. Our next question is for Dr. Davis. We've got a few for Dr. Davis. The first is what are the details on the February 10th vaccine event at Clover Bottom? Dr. Davis, can you kind of explain some of the details?
Yes. So we had an event back on January 23rd for Clover Bottom, and we did not feel that we got everybody covered, so we scheduled another event for February 10th. And when I say everybody, from Davidson County is what I'm referring to. So we scheduled another event for February the 10th. It is available for people who did not get their first dose at an earlier point or with some other option to be able to come and get that first dose, and then we'll be scheduling another one 3 weeks later. That event is the way to get scheduled for that event is to contact our didd.covid19@tn.gov email address, and to let us know of your need, let us know how you meet the criteria for phase 1A1, and then we will send you a link so that you can schedule an appointment for that event. It's going to run from 8 a.m. to 12 p.m. on February the 10th. Kara?
Great, and stay on the phone. Can you please explain your new START initiative?
Yeah, I'm so excited to tell you about the START initiative. This is 10 START assessment and stabilization teams. And so what we're doing is establishing 5 teams across the state, 5 teams composed of a manager and 4 assessment and stabilization facilitators. And so what this is basically setting up a crisis system for people with IDD that will collaborate very closely with mobile crisis, with mental health hospitals, and with other entities that come into contact with people in a crisis, so that we can facilitate more timely admissions when they're appropriate, so that we can divert from psychiatric admissions when that's appropriate, and we can develop a very solid crisis plan for people, so that if the police are going to be involved, they know what their level of involvement will be. If mobile crisis is going to be involved, they'll know what they're doing. If the person can be diverted to respite, we will have already pre-identified that respite facility to which they'd be to which they would go. And in cases where we're able to, we're going to try to keep people at home, because that's really the best place to be, right? If you can solve your problem right there at home, it's always the best. The other part is that, we're going to facilitate a lot more connections with mental health resources that may be out there to prevent these types of occurrences as well. So this is it's a fantastic program. I will say we had a pilot of this back in the mid-2000s. We were actually one of the first states to pilot this back in the mid-2000s. It was a grant-funded program at that time. It is now, it's part of our budget. And so we're very happy to have this program to get up and running. I think it is something that we've needed for some time, and I'm very, very excited about it. Michelle Bagby is going to be our director, and she has been, along with me, interviewing people for these positions during this past week. We'll continue those interviews next week, and hopefully have a full cadre of staff for that beginning here in a couple of weeks. We've got to get them trained. We're working with the Center for START Services to get that training for them. And if you want to find out more about START, you could go to their website. It's the center. I know Michelle is going to put it up in the chat box, so I'm not going to try to say what their website is, but the Center for START Services, they're great consultants in all this. They're going to conduct training for our staff, also for our respite facilities out there, so that they're on the same page with everything that we're doing. It's bringing this whole system together so that we can better support the needs of people with intellectual disability and co-occurring mental health disorders. So, Kara, I could not actually be more excited than I am about this program.
Dr. Davis, I really had a hard time fully gauging your enthusiasm level, so maybe you need to up it just a notch next time.
Okay, I'll do whatever it takes.
No, I can tell your excitement. So So we're excited to have this program on and get this all started. Someone did ask, and it was also a submitted question, is how can we publicize the event on 210? Dr. Davis, do you just want to explain how we're because this is a very targeted population that we're trying to reach, how we're doing that?
Yeah, this is primarily a Davidson County event. I'm not saying that, it's not against the rules for us to put somebody else in, but we do have some other events that are upcoming that I can make you aware of. And what I'd prefer to do is connect people with something that's happening in their area. And this is going to take me just 1 second to pull up here because I thought I had it open, but I apparently did not. So just give me 1 second to get to this information, and I can tell you about some upcoming events because I want you to specify your county when you email into COVID didd.covid19@tn.gov, and we're going to try to connect you with something in your area. Right here it is. Yep. Oh, here we go. All right. So what we have upcoming, we've got several second dose events coming up. But we'll start with first dose events that we've got on February the 12th that we're going to be, and these are all events in which our DIDD nurses are going to be assisting. We've got an event coming up at Progressive Directions. It's going to start at 9:30 a.m., and this is going to be in Clarksville. So if you're aware of people in Montgomery County or the surrounding counties, then that's a good event for us to connect them to. Again, what I'd like you to do is to email didd.covid19@tn.gov so that you can we can connect you with that event. On February 16th, there's also going to be an event. This is also going to be in Clarksville. So if February 12th didn't work out for you, then February 16th might, but that's going to be 9 to 12 at NIA Association in Clarksville. Then on February 17th, we have a 9 a.m. event at Brightstone in Williamson County. And so this has been something we've been really wanting to get, is something happening in Williamson County because there have been some delays there, but now we're able to go ahead and have that. That's going to be on February 17th. It's going to start at 9 a.m. And so anybody in Williamson County or any of the surrounding counties who might need vaccination, that would be a good choice. And then on February 18th, we've got an event at Prospect from 9:30 to 4 out in Lebanon. And so that is one more. And I actually thought there was another Rutherford County event coming up, but I might have missed that one. So no, there's not. So those are the first dose events that we have upcoming, and you could specify one of those events if you email into COVID-19, or if you just tell us what county you're from, we'll connect you with the right one. Carol?
Great. Thank you very much, Dr. Davis. And the reason that we haven't posted any of this on Facebook is because these are targeted events and reservation only, and we must keep to the criteria, and Facebook is very wide. There's been so many instances of people cutting in line and folks trying to get access to the vaccine when they're not in the correct phase, that we are preferring to use a more targeted approach to reach people to prevent that on our end. So just wanted to make sure people were aware of why we're not posting this stuff on social media, because we are trying to make sure that these events are reaching the intended audience and not the general audience, given everything that's happening in Tennessee and across the nation with concerns over line jumping. So we will continue on now. Please shed light on parent primary home caregivers' eligibility for vaccines. Dr. Davis, do you want to take this one on?
Yes. So just to make clear where we are right now, and I'm going to give just a quick bit of history. I'm going to try to do it in a succinct fashion, but this started out way back in October when we were discussing vaccines, and healthcare workers for persons with intellectual and developmental disabilities who were in long-term care facilities. And so what we classified as long-term care within our system were ICF settings, Medicaid waiver settings. That was the universe that we were talking about. And those healthcare workers were in phase 1A1 at that time. Persons with intellectual disabilities and developmental disabilities who were in those programs were at phase 1C. Based on our discussions with Department of Health, persons in that 1C category were elevated to phase 1A1. Then on December 23rd, persons with any person 18 or older who could not live independently, so a person with IDD over 18 could not live independently, was added to the priority listing. And so that was added to phase 1A1. That did not include the families of those folks that were elevated. That was an elevation of the person supported. But it also stated that anybody in that group who did have healthcare workers that worked with them, that would include them as well in phase 1A1. And so people who can describe themselves as healthcare workers or home health care workers are being vaccinated in phase 1A1. If you're not in that category, then you cannot be vaccinated at phase 1A1. Recently, the health department added some people to phase 1C that had not previously been addressed, and that is the parents of people under or the family caregivers of people under age 16. So those are people who could not receive the vaccination because there's no vaccination available for anybody who's not 16 and older, that the families of those folks could receive a vaccine in phase 1C. The other group that I want to mention here is that I had recognized that people who were 16 and 17 were left in between here. And although there has been no official notification of it, I am available to try to connect people who are 16 and 17 to a vaccination opportunity. Of course, you need to know that it has to be a Pfizer event for 16 and 17-year-olds because Moderna is not approved for use for people under age 18. One other thing I will mention, I was on the stakeholder call for vaccination stakeholder call yesterday, and one of the things that is announced is that the Johnson & Johnson vaccine and the AstraZeneca vaccine that maybe you've heard about is going to be, those are going to be coming out soon and available for people to be able to get vaccinated. And so that's just a little bit of a heads up that's upcoming here in the future. So, Kara, that sort of outlines a little bit of where we are currently with respect to vaccination of different age groups and different people in different types of settings. So, Kara.
Commissioner, would you like to add anything?
Again, I just wanted to say publicly how much I appreciate Bruce and his team, and I know that a lot of the providers have shared that similar sentiment about the work that they're doing. And Bruce is the first to also do this, but publicly thank Department of Health. A lot of folks don't see some of the things that they're having to do behind the scenes to make sure that they help us pull off these events. Commissioner Piercy, Dr. Abramsky, several folks from Department of Health have been exceptional partners with us. And it's really been an exercise in what good government should look like in communication and not allowing silos to impact people that we're trying to support. They have been very responsive and very receptive to any of the things that we're bringing up as far as needs for our community. One of those things, too, that I wanted to share that Commissioner Piercy is also very excited about is as more and more of these vaccines come online, the hope is to be able to accelerate some of what that timeline looks like. So I know that there's folks wondering when they're going to be eligible, and as some of these vaccines start coming online and supply chains open up, you're really going to start seeing more of a windfall for Tennessee getting vaccines from different groups. And one of the things to remember, this was brought up A lot of folks look at these numbers when you see that Pfizer was 94% effective and Moderna was 95 or whatever the numbers might be. Historically, the flu vaccine is 40 or 45%, Dr. Davis, on a good day. And when you're hearing about Johnson & Johnson being 85% or 80% or 70%, whatever that is still significantly higher than historically what the flu vaccine does. And so we don't want people getting discouraged when they hear those numbers and saying, well, I'm not going to get that. I'm going to wait until Moderna is back in or Pfizer's back in because of that number. These vaccines are incredibly effective, and those are things that we want to make sure that we continue to promote actively, is that these vaccines are all working. And they've all been tested very successfully through a lot of the rigors that a traditional vaccine testing goes through. So as you're hearing people talk about saying, I'm going to wait and just some different things, just continue to encourage them around the science of the vaccine and the experts and the conversations that they've had, because we are very comfortable with what's been happening with the Department of Health and the information that they're sharing with us about the efficacy of the vaccine and the process that we're using. They have applauded us, and we want to make sure that we publicly pat them on the back as well for everything that they've done for us, because I can't speak to it with the same authority as Dr. Davis, but a lot of the things that we've asked them for help on, they've not just answered. They've been very excited and very proactive in trying to figure out how do they help us make sure that we reach our population, and Commissioner Piercy has publicly done that. So just hang in there. We're getting there. We're going to continue to get there as Johnson & Johnson comes online and some of those shipments and the emergency authorization starts happening this month. We're going to get more of those, and it will allow us the flexibility to also start having conversations about additional populations that need to be included in phases similar to parents and some of the conversations that have been happening. We're actively working on those things, and I'm hoping that as things come online, we're going to have an opportunity to really accelerate the vaccines in Tennessee and get these into people's arms. Thanks, Kara.
Okay, next question, Dr. Davis, you get a break. Jordan is back up on deck. Multi-phase question about employment integration and ECF and DIDD. So with alignment integration, how do you see the differences between ECF and the DIDD waivers resolving? Jordan.
Yeah, Kara, thanks. So I think that we're going to continue, as we have here with these initial amendments, we're going to continue to try to align the menu of services and the modality of each of those services. A good example are the employment services. We certainly want to bring some of the successful components, the pre-employment stuff, the employment-informed choice concepts. We want to bring those because they've demonstrated an effectiveness in the ECF program. We want to make sure we're availing those opportunities to folks in the 1915C program. As you guys know, and we've talked about quite a bit on 7-1 and for the foreseeable future, the menu of services in each the ECF and the 1915C program will remain exactly consistent with what they are today, with the exception, obviously, the intent to add a specific enabling technology benefit to both. And then as we move forward, as we've talked a little bit more over the last couple of months about that single system design concept, I think that that's where we're really going to have an opportunity. The end goal is to have a single menu of services that meets the need of the entire spectrum of folks that are receiving services within the waiver programs. That's down the road. That's going to take us a little while to get to, but the alignment, the actual aligning of both the ECF and the 1915 program under the operational leadership of the department, and certainly under the purview of the MCOs, is kind of the first step in solidifying a single system down the road. So I don't know, I hate to use the word resolving because I think that there's kind of an insinuation that the services need to be fixed in some way. I think really what we're doing is taking the best from both programs and trying to make sure that everybody going forward has access to all of those advantages.
Thanks, Jordan. And before I get to the part of the question that I'll answer, I'll actually ask you the part of the question that just to expand on for you, who will be in charge of ECF operations? Jordan.
So under the alignment, obviously the Employment and Community First Choices program and 1915C waiver programs will fall under the direct purview of the managed care organizations. The department will hold an operational agreement that defines the context within which the operational authority of the department moves down to the managed care organization. So we'll hold an operational agreement essentially over the MCOs. The MCOs will maintain the network, the services, policy, procedure, that kind of stuff with provider agencies and ultimately over services.
Okay, so the part of the question, thanks, Jordan. Part of the question for me was, will ECF receive the quality and quantity of communication that DIDD does, and will that be united? First of all, thank you for the compliment of thinking that we are doing a good job. Couple of things. One, we have already established a work group with the MCO leadership, the LTSS leadership at the MCOs, along with TennCare, to meet to identify strategies for communicating going forward. This is something that they are interested in improving as well. So I think we've got some good strategies laid out. In addition, DIDD is looking at options as to how to establish a direct line of communication with all people interested in learning about services and supports. So ECF, people and families, ECF, DIDD waivers, those who are on the interest list. It would be an opt-in type of communication channel, not something that would be mandated, and folks would have the opportunity to opt in, and it would not replace official communication via the MCOs or via DIDD or TennCare or anyone else. But we are looking at different strategies so that we can make sure that we're communicating as effectively and efficiently as possible with all of our various stakeholder groups, and continue to raise the quality even on the DIDD side as well. So those are some things that we are looking at. Will it be united? I will say this: communication from DIDD to folks will always originate from my office when it comes to things that are coming from DIDD to folks in either program. And sometimes that stuff is specific to ECF, sometimes that stuff is specific to DIDD, and that probably won't change, but we are looking to establish various paths for communication. So that is my answer to that question. Next question, and this is our last pre-submitted question, is what will our DIDD license review be like for the year, and will there be visits by the licensure staff this year? So I'm going to move this over to Dave Harrell, who is our Director of Risk Management and Licensure. Dave.
Thank you, Kara, and thank you for the question. Our licensure rules have always given us the ability to place a license in extended status. And with the governor's executive orders that started after COVID and also through Appendix K, we have the ability to keep that going for at least 6 months beyond the end of the state of emergency. So to answer the question, we feel like we predict that all of our licensure visits, or as many as possible, will be virtual for the foreseeable future. Now, we are doing very rare in-person visits because those are kind of required when there's a new home that's opening or something like that. But as you can imagine, when a new home opens, there's nobody living there. So we're doing all we can to protect both the people that we all serve and our licensure staff from being exposed. Hope that answers the question. And back to you, Kara.
All right, thank you very much, Dave. Appreciate your answer. Okay, so before we get to questions in the chat box, some of which have already been covered through some of the pre-submitted questions as well, I want to turn this over to Teresa Sloan to discuss a little bit about reportable event management. We had a really good WebEx discussion last week, but I think she wants to clear a few things up about some misconceptions that remain out there. So Teresa, I'm going to turn it over to you.
Held a 2-hour WebEx on Thursday to kind of go over some questions and concerns that stakeholders had regarding the integration into the one reportable event management system. During that call, it became pretty obvious that we were going to have to do a lot more outreach and a lot more discussions, especially with choices providers who are solely choices providers, because it's going to be a whole new environment for them. As a result of that, we've scheduled our next WebEx for next Thursday for another 2 hours. The real topic of that one is going to be a concentration on the reportable event management protocol and definitions, which you can find on our website on the reportable event management page. They're there. You can grab them, read them, come to the meeting with questions you have, or you can also submit questions through the special mailbox, which is also a link to on the REM website. The one thing I wanted to clear up today, specifically, since we've received quite a few questions about it since last week, is that when the system goes live, we are not going to have an automated computer-generated system where you can enter information. We're going to have to still operate with a manual process until the state acquires software in a system to be able to allow for real-time reporting. Previously, we had worked on a system called Focus, and we're hopeful that that system would be able to manage the real-time reporting for the integrated system. However, we've come to realize that there are some options out there that we could utilize more quickly that may be able to better work with other units and other parts of our system. So Focus will not be a part of the REM system. If you read through the protocol, it's been removed. So we will go over that next week. But if some of you guys wanted to know about Focus now, I just want to kind of get that out there. Thanks, Kara.
All right, thanks a lot, Teresa. Appreciate that. Okay, so we got a little bit more time, so let me go back up to the top of the chat box, see what we've got here. Okay, first question, and I think I saw someone answer it in the chat, but we'll just answer it for everyone. Will START services be available for ECF and choices persons? Dr. Davis, you want to take that on?
Yes, yes is the answer to that question. It will be available to, really, you know, the vision is that it's going to be available to everybody with an intellectual or developmental disability across the state. We are going to have to stage it to some degree, and we're going to initially serve people who are in the IDD waivers and the ECF waivers and translating that to the integrated system, people who are part of that integrated system going forward. But eventually, this program is designed to address the needs of people who live at home or who live, you know, in other types of settings besides those that are sponsored by Medicaid waiver programs. So it will eventually spread to that level. Kara? And I should also mention, I just realized I had left out children, but we do plan to eventually expand to serving children with this program as well. So it's an as the commissioner is often bringing up, our department's a cradle to grave program, and this service is going to be offered eventually to everyone across that spectrum. Kara?
Great, thanks a lot, Dr. Davis. I do see the advice to potentially discuss this with the MCO advisory meetings to explain START. So we will take that back and see whether or not that we can make that something that can happen. I think that's a good forum because I have attended those recently to discuss integration. Do we need volunteers to help with the vaccine events? Dr. Davis.
Well, I'm going to take that offer under, you know, I'm going to keep that offer in mind. Who made that offer? Because I may want to reach out to them. We have utilized regional office staff for this purpose, and it is our nurses who have sort of coordinated those events and our regional office leadership. But, you know, to the extent that we could use volunteers, I may reach out to some people about that. Who made that? Who asked that question?
I see Melanie Lamb. So I would say to email the COVID inbox
Yep.
and let us know, or, and that way we can compile a list if that is needed. Have a lot of questions about spreading those dates and those times for folks to distribute via networks. We will work on getting that information out for folks to be able to distribute. While we don't want to do it via social media, we do, like I said, want to have targeted communication and through some of the networks like the Council on Developmental Disabilities and folks like that. We absolutely want to make sure you have the information so that we can capture people who may be eligible.
Kara, the primary concern there is we can't have people showing up to those events without having contacted us first, because we have to limit the numbers. And actually, Jay Albertia, I didn't mean to surprise Jay with that information about us potentially adding some folks to the event that they have scheduled in Clarksville and to some of the other events. But we've been in contact with the Mid-Cumberland region. When they requested our assistance with it, we asked to be able to add some people to those events. And so we are all going to be in coordination with one another, the local health department, the regional health department, and DIDD and the agency as we schedule additional people to be involved. Kara?
That's right. And one of the things that we're doing from our communications end is whenever we are talking about the events, we are stressing the fact that this is a pre-registration, and where the event is already at capacity, making sure that we are making that known as well, so that there's so that we don't just have folks showing up, you know, out of the blue,
right,
because that happens. And there's only, as you all know, there's only a certain amount of vaccines that they bring on any given day, and we want to make sure that the folks who have been pre-registered are and have that appointment are able to get that vaccine when they show up. Especially since we've staggered them. For instance, in Shelby County, which Commissioner and I had an opportunity to go to last Friday, they scheduled certain agencies at certain times, and so some folks weren't scheduled to show up until 3:30 or 4 o'clock, and we wanted to make sure that, you know, just because they were scheduled late, they weren't not going to have a vaccine available for them. So just kind of understanding some of the thinking there. Okay, is the Family Support Program considered a waiver program? No, it is a state-funded support program and not a waiver program.
Kara, let me just add something there, though, because I think if the person's asking if people who are in the Family Support Program are eligible to receive a vaccine in 1A1, yes, they are if they're 18 or older, have IDD, and can't live independently. So we have reached out to Family Support Program people to be able to try to connect with them and get them connected with an event. I would suggest that anybody who's in the FSP program, if that was, and maybe I completely misread that, but if that was the reason for the question, then you should get with the agency that provides your Family Support Program, and they can help you get connected with an opportunity.
Yes, and we have sent out some notification to family support agencies to assist them in letting folks that are in that 18 or older who do not live independently category to help them notify those folks about these opportunities. Dr. Davis, not sure you have the answer to this question, but two people did ask if we have had any side effects reported to us from people we support or staff receiving the vaccine.
Some of the, people I have these are anecdotal reports, and I think everybody has heard them, that some people have had some side effects as a result of taking the vaccine. Most of them have been relatively minor, but some of them have lasted for a few days particularly after the second vaccination. So, you know, it is certainly possible that you will. Many experts have said that if you're experiencing those side effects, that may be an indication, a good indication, that the vaccine is actually working and helping you develop those antibodies that you need to combat the coronavirus. So yes, there have been some side effects. I have not been aware of any serious side effects up to this point, and you know, there have been some reported in the media, but they've been relatively rare. So that's all I could say probably about that. Kara?
Yeah, and our provider community probably because they're seeing their staff and they're seeing the people they support, or have also, and they've received vaccines as well, probably have a little bit greater awareness into those, into any side
Kara,
effects.
with that, yeah, with that, I will make one other point, though. It does not necessarily prevent you from testing positive for the coronavirus or for getting the coronavirus. And so this is one of the reasons that we have continued to say you must continue to do the other precautions that we've talked about: masking, distancing, washing hands. All those things still have to continue even after you get the vaccine, because you still may get the coronavirus, even though you don't develop the severe symptoms associated with COVID-19, and may be able to pass that to someone else. And so it remains important to carry out all those precautions even after you've had the vaccine.
Great, thank you very much. Okay, so we're at 10:12. This meeting is until 10:15, so we are almost at the end. It's been a good discussion, everyone. We hope that you have found it useful. And with that, I'm going to turn it over to Commissioner Turner to see if you say a few words and see us all out.
Yeah, thanks, Karen. Again, thank you for the discussion today. Obviously, a lot of good questions and a lot of conversation, and I know there's been a lot of focus around communication. And I think everyone knows that's something we talk about all the time here. Kara and her team are on top of the game all the time and help lead the state in what effective communication looks like, and especially now when it's so critically important to get that information out. We count on accurate information being sent out, and that's why a lot of the communication coming from our office, Kara and her team take great pride in. So I appreciate them doing that. And again, please let us know what we can do to continue to communicate to you and make sure the right information is out there. As Kara alluded to, and Dr. Davis has talked about, some of our biggest challenges are when people get bits and pieces of information and run with that as fact, and that causes confusion, whether it's around vaccine drives or waiver integration. Confusion in general around things is bad, but especially in our population, it carries significant consequence if we're off. So if you do hear something that you're just wanting to know if that's accurate, please continue to keep us in the loop and let us know. We'll certainly work to get you the right information, because we want people being comfortable and knowing what's going on, and we take pride in that. So thanks again for your time today. We look forward to seeing you guys next week, and if there's anything that comes out in between that, let us know, and we'll certainly work to make sure we get you some good information. Thanks, Kara.
One date thing I want you all to know about, the Governor's State of the State is on Monday, February 8th, yes. Obviously, that is when he will unveil his budget and priorities for the coming year, and we are all excited to see what's in store. So we hope to communicate some information with you once that is all released, and we'll look forward to sharing some information with you in the near future. Everyone have a great day.